an expert on diabetes. I heard you give a wonderful lecture last year in 2019 on diabetes. Talk to us about the epidemic of diabetes.
Yeah, well, epidemic, we call it an epidemic, but at this point, it's a global pandemic. It's really a scary concept to think that the entire world is at risk for developing diabetes. And I'm certainly passionate about this topic because there's clear evidence that the disease can be prevented and in fact cured. We know that diabetes is associated with higher rates of cancer, Alzheimer's, heart disease, and these are all leading causes of death. So every provider really needs to throw their hands into the ring under this epidemic because so many people are at risk for developing type 2 diabetes. And the human brain, really is perfectly designed to become addicted to sugar. I repeat that over and over again, and that's what I want the public to know. Sugar impacts some of the same chemical pathways in the brain impacted by opiate drugs. We all know what a problem that is, but in terms of scale, the diabetes epidemic is killing millions more. And so, of course we have to pay attention to this. As I said, sugar is it's powerful stuff. And most people don't even know that sugar is hidden in many of the foods of the standard American diet, so to speak. They have trouble identifying what foods have sugar. There are over 50 names for sugar that are allowed in food labeling. I highly recommend that patients figure out these names. There's a great resource. One of my favorite docs, besides you, of course, is Dr. Robert Lustig. I call him the sugar doctor, but he's an amazing pediatric endocrinologist who's dedicated his life's work to stopping the epidemic that we call diabetes. You can go to his website. I think it's it's actually robertlustig.com if I'm not mistaken. And there's an education section there. And I tell people, go, look, find, figure out what that list is of stuff and read labels. People simply know that most foods contain sugar or simple carbohydrates. We can identify some foods, right? Bread, pasta, rice, desserts, but most people don't understand this in most packaged food. In fact, the CDC can actually measure what we're consuming as a U.S. population. On average, considering how much sugar is used in our food, it's about 17 teaspoons a day. I mean, nobody would intentionally do that, right? Nobody would intentionally do that. So the threat is hidden in our food, and I encourage people to really pay close attention to that. And a really simple rule to follow is more daily vegetables, some fruits, less meat, less sugar, right? Ditch the packaged foods and all the soda. And you can, if you really want to get into this and you're motivated as a patient, or quite frankly, even as a doctor, I really encourage my colleagues to get on this train, pay attention. I would start with the book called Fat Chance by Dr. Lustig. So that's one of my recommended reads.